Okay, we're going to get into improving the cervical curve with some neck exercises. What Dustin has done is he's wrapped a towel around a light band, and he's going to lay on a firm surface in a bed, and he extends the arms, as you can see, with the arms locked into extension, and he's going to come to neutral and go back into extension with his neck. He's going to do about a repetition of 10 times. But the arms have to be separated enough so that the band itself is not putting pressure on the arteries of the neck. And now he's going to extend one arm out to the side and one arm straight up. And this is going to activate the SCM. You can actually see the SCM muscle being activated. You're going to push into the cheek or the chin or the forehead, whatever feels comfortable. But really creates a great stretching effect and contracting on the opposite side. Actually feels real good. I'm going to do the same thing the other direction, 10 repetitions. There's not too many exercises that activate the SCM muscle, which is in the front part of the neck on the side. You can see it contracting there, and this is real good for that. And lastly, he's going to point the arm straight down and out so he doesn't choke himself. And he's going to get a different fulcrum of angle on the neck as he goes into extension. And it's going to help to stretch the anterior neck muscles and use the band as a fulcrum into the vertebrae to increase the normal curve of the neck. And you see the different size of the bands. The light band on the left, the monster mini band on the right. So based on the patient's strength, now Amy, she's not as strong as Dustin, so she's going to take the monster mini band, which doesn't have as much strength as a light band, and she's going to perform the same exercises. Now, of course, she's going to put her hair up so it doesn't get tangled up in the band, which will make the exercise a little uncomfortable. But you can do this without a towel, but it seems to really irritate the skin, so we prefer to put a towel on there. Again, the patient, once they lock their arms, it's pretty easy to perform the exercises. And she's going to go back into extension with that band as a fulcrum right in the middle of her neck, just below the base of the skull. Repetition of 10 is pretty much all you need, and you'll get a good stretch, and it'll feel really good on the neck. So then we're going to take one arm, go straight up, and the other one out and down. And she's going to rotate towards into the band with her face. Again, you can see her SCM muscle activating and strengthening that side and getting a good stretch. Now we're going to do the opposite side again, 10 repetitions. And you will get some people who find this a little uncomfortable, but once they get through it and feel how much better their neck feels, it's really not that bad. Loosening up a lot of the muscles in the front and the back of the neck. And lastly, again, she's going to push down and make sure her arms are out so she doesn't choke herself, and go back into the extensions again, getting a nice stretch of the anterior neck muscles and helping to restore the normal curve in the neck.